So society, the field, clinicians need an alternative model. And I think the good news is that we have some people who are really being thoughtful about that and really trying to say, where do we need to go? And how can we, as a psychologist, how can we learn more about assessing and identifying different kinds of suicidal states so that we're getting more sophisticated about different kinds of ways that people are suicidal, some of these individual differences at that level, to then develop treatments, because one-size treatment doesn't fit all. So treatments for this kind of way of being suicidal, this kind, that it may not be 15 different treatments. It might be only 2 or 3, major ones. But the idea, I think, is not naive, that we could really get better at, and we are, I think, getting better at understanding different suicidal states. And while it's still in its infancy, get randomized clinical trials together, like the work that Marsha Linehan does, like the work that Greg Brown and Tim Beck do, hopefully like the work that we're involved with right now, to then be able to match to different kinds of suicidal states, different kinds of treatment responses that will be well-suited and actually help, avert those tragedies. And from my bias, I think the onus is on clinicians and especially researchers to lead the charge and to say to managed care, we really feel that if we can decrease inpatient hospitalizations or avert primary care visits or ER visits, which we were able to show retrospectively in one study, and we're trying to prospectively do in a clinical trial, then we're saving you a lot of money. That's fine. But because of that, then we feel like you should then support intensive outpatient care, which is going to be much cheaper because we're saving you all this money on this side. Now, again, that may be really naive to think that we could actually make that argument and somebody would actually buy it. But I really want to say that I think that that's what we should do and where we should be going as a field for sure. And I think that's in the best interest of the patient.